Hi everybody, this is Azar, physical therapist. Today I want to talk about the nerve entrapment in the elbow area. As we already talked about the nerves, we have three main nerves in the upper extremity that's starting from the base of the neck, out of the vertebra, down to the fingers. I'm going to show you them again. This is the demonstration of the nerves. Here we have ulnar nerve and median nerve, as you can see. These yellow ones are the nerves. If you look at them, they get off the neck, go all the way, and they can get trapped on the elbow. That's actually the second area of entrapment. We already talked about that it can trap in the neck area, around the base of the shoulder and the chest. And then if we go here, we can see they can entrap underneath the bone and between the muscles, and that's the median nerve. That one also can get entrapped underneath the muscles in the elbow. We have also radial nerve. Is less common to get entrapped in the elbow area, but it can, of course, get entrapped there. If we have a nerve entrapment there, we somehow have a symptoms that they are similar almost to the neck entrapment of the same nerves. Because they are the same nerves, they eventually innervate the same part of the hand, and we get numbness tingling on the parts of the hand that they are common if the nerve entrapped on the neck or on the elbow or even on the wrist. Sometimes nerve can get entrapped in the wrist, which we're going to talk about later. First of all, we're going to talk about the median nerve, the main nerve that can get innervation to these three fingers, thumb, index, and the third finger. The median nerves usually innervates the palm of the hand, not the dorsal, the palm of the hand, that area. And a lot of function can happen with that if we have good nerve, and a lot of dysfunction can happen if we have the nerve that is under pressure somehow, either here, here, or there. If we have entrapment on the teres, pronator teres muscle, which is very common entrapment of the elbow, one of the muscles that can do that function, go down, we call it pronation. If we are going to be having symptoms while we have resistance against that motion, and we have pain in here, then we have that symptoms. I'm going to have to show you that picture. That's how the median nerve can get trapped, you can see, and that's how the symptoms can happen on the fingers. So what we're gonna do in that case, we have to stretch the pronator teres muscle that is here, that's putting the pressure on the nerve. That's kind of simple. At the same time, it can be very annoying. First of all, the physical therapist need to diagnose you to make sure that is not that the problem with the numbness tingling of this three finger is not coming from the carpal tunnel, which is very common, or is not coming from the entrapment of a nerve up here on the neck. If they figure that's pronator teres, we're gonna stretch that muscle. We're gonna supinate the hand, abduct the shoulder, and stretch this. We can do it on the wall. Stretching this muscle. It might be very numb and tingly and very tight, that nerve, because the median nerve is entrapped. As we already talked about, we can do the simple median nerve stretch this way, and that's going to be painful too, but they are common between the neck and this. This one the neck doesn't have to move if it's entrapped on the elbow. We just need to do simple supination, do this, and stretch that. If you want to stretch the whole nerve again, you can add the neck part to it. And you can also do it on the wall. The second syndrome that can happen is the cubital tunnel syndrome, which is for the ulnar nerves, on the ulnar nerve on the that elbow area. So it's passing underneath a lot of muscles and goes to the back of the elbow, the ulnar nerve, and then goes to the area that we call it funny bone, this one. You probably experienced that, ouch, when you get that tingly when you tap on this area. or when your hand hits somewhere really hard, you start feeling the electrical shock on this little finger. That's the ulnar nerve, responsible for little finger innervation. For fixing that, we should stretch the ulnar nerve. The best way of stretching the ulnar nerve, we already showed you this in the neck part. So you can do this, or you can do it this way. It's gonna be more precise. You can feel it on your pinky finger. When you do that, stretch it, hold it for 30 seconds, relax. And also you can get some stretches on the triceps, because the ulnar nerve is passing in the back, almost there in the triceps area. So we can do this, stretching the triceps muscle, making sure you release that. Also, to generally loosen up the median nerve in the front, you can do the biceps stretch, which is going to be this way. You're going to stretch your biceps by doing this. So this is a bicep stretch versus tricep stretch. That way we can get rid of the pressure of the nerve around that elbow area. Of course, it's not all stretches. Sometimes the stretch is going to be very annoying and you cannot tolerate. That way you have to go to the physical therapy, and then they're going to give you the ultrasound and massage and other stuff to help you loosen up that scar tissue around the nerve and help the nerve to move better. So if you start right away the stretches and it's so numbness and tingling causing and very painful, stay away. Go back to physical therapy and have them do the anti-inflammatory procedure for you to be able to get ready for the stretches. Thank you for watching and have a great day.